Hey guys, Don here. Welcome to Podiatry Practice Mastery, helping you get past the $1 million mark. As I always start with, I'm going to start with my MVPs of the recently. So I had a new patient. She came in. She was a 49-year-old female, and she was having a lot of tightness in the lateral lower leg region. She was here for a second opinion. I tend to find second opinion patients are good patients because they've usually tried and gotten treatment other places. She had tried physical therapy with the Graston technique on her peroneals. She's kind of had pain around the lateral malleoli region and really nothing on her x-rays, just a lot of tightness in there. So she's going to get bilateral shockwave focused in radial to that area on the lateral foot and lower leg region. So that was a kind of an MVP. There were two orthotic patients. One was a 17-year-old boy that had some foot pain, and he had kind of high arches. And the other one was a 68-year-old female who had some pronation and some neuroma pain. So that was orthotic number 2. And then the last one was a patient. She was here for a follow-up, 67-year-old female with plantar fasciitis. Now this is interesting. She was feeling better, but since I talked to her about the ultrasound, she wanted an ultrasound. Okay. And so I compared the bad side, which is the left side, to the right side, which is the good side. And she can see on the left side that was thicker. And I kind of explained what that meant, that the thickness meant that the tissue isn't as mobile. And, a lot of my patients do well with the shockwave. So she was feeling better. She wasn't planning on doing anything, but after doing the ultrasound, she decided to do 3 rounds of shockwave. So those were kind of the MVP patients I wanted to share with you. I always think that's good just for us all to kind of share our MVPs. So what I want to talk today about is I'm hoping my next $1 million idea. So I was recently at a conference where I heard this great idea of from Dr. I think it's Domalak, and she had this idea of this recall system. And I've been busting my brain around how to make this report on how to kind of do things like with this type of a report. And it was kind of a struggle, and I wasn't able to figure it out. And and so I kind of gave up on it. I tried to do it on my own, didn't work. And now it's like a idea that happened today. I had a little time, and I went to the EMR, and it had like where I can ask a tech or help question. And so I put it in the chat bot. I'm like, can you help me do this report? I want a report of everyone that hasn't been here for a year to 4 years. So like a 3-year window. And they like sent me the parameters, and I was able to make it very easily, this report. So this report spans 3 years from January of 2023, January 1st, 2023, back 3 years. So that's where it goes from. And so I was able to make that report. Now, my staff gave me some input because I made the initial report, and they said, well, Don, you better make sure no one's dead. So I could add show only patients without a deceased date. And then we really didn't want to see routine. So I took out all the patients that were here for routine appointments. And I also took out patients that didn't have a follow-up appointment. So the parameters were appointment type, anything but routine, patient deceased, no, patient last seen within that 3-year window. So if they were seen recently, they wouldn't go in that window. And then patient next appointment was no. So there's no next appointment scheduled. So that I made that report. It was pretty easy to make after they showed me, and I struggled with for 6 months. So if you're struggling to make reports, just ask your EMR people and save like 8 months. I made this report. It came up with the original was 10,000 people. And then the other one was which after I deleted out the routine care, was 8,000. So I put this into a report on the cloud. And now it has HIPAA information, right? So the report has their patient name, their ID, when they were last seen, their home phone, mobile phone, and email. I put this in Excel, but it's something that's only for our office. And so I was able to share it with my office staff. I have a couple of other columns. So I put first contact, second contact, and then it has options within there. And I can show you this if you need it, but basically you just go into data and you put in there, does not need appointment, does not want appointment, scheduled appointment, or left voicemail. So contact one, contact two, and then who made the appointment. It has the staff name. And so the staff is going to go through this. This is my first rendition of kind of doing this for the last 3 years, all these patients. And then once that's done, then I've kind of learned how to make these reports. And so the whole idea would be to make one like in January, all the diabetic patients; in February, all the AFO patients that haven't had an AFO in 5 years; in March, maybe all the orthotic patients; in April, all the EPAT patients, to do it kind of diagnosis specific. I also gave my staff some scripts. So my scripts are, if they answer it, hi, this is name Don Pelto from Central Mass Podiatry. I see that the last time we saw you in the office was a certain year. The doctor recommends another office appointment if you're having any issues. So I put it that way versus, do you have any other issues? It says the doctor recommends another office appointment if you're having any issues. Can I make an appointment for you or your family member? Can I schedule that now? And if they say no, if they like, there's no answer, then you if there's no answer, then you do the same thing. Hi, this is Don from Central Mass Podiatry. I see that we have not seen you since whatever 2022. The doctor recommends a follow-up appointment if you're having any issues. Please contact the office to schedule it with that phone number. So I put this in there, and my staff are going to be kind of working through this, and then we can see who made the appointment. So the thought is they're going to do this in their downtime. I've thought about using like a virtual assistant as well to do it, but I'm going to start by using my staff. If they have time to do that, that'll be better. And then based on the appointments that are made, let's say they get $5 per appointment, whoever makes them and has downtime, then we will split that bonus kind of amongst the staff. Now, there was a question they had for me, is that we tend to bonus, or not bonus, but we tend to forward load the partners versus the associates. So their question was, well, right now we're supposed to fill up all new patients with the doctors, the new doctors versus the associates. So I told them, well, with this method, you can add them to if they request their own doctor that they've seen, like they've seen me in the past, you can put that in, but we would try to push it to the associates or the new doctors that are starting. That's the whole goal for that, so we can get busier. Because the issue we're having is we have a fourth doctor that's a little bit slower, and we're considering adding a fifth doctor, and so we want to keep them busy. So that was one kind of big step. Was for the last 3 years, 10,000 patients. Then the other thing I learned how to do today, which has made another report of everyone that hasn't seen us 3 years or more. So those are all like almost like the patients that are just lost. And for them, I did a similar type of a report. This type of a report was for that. So in the library, it was patients that hadn't seen, and I use something called, we have a communicator, it's called. So basically it's a way to get in contact with patients, and it's called a campaign builder. And there's something called a campaign library. So we have these like kind of libraries, and they're already doing this. If patients, these are already things that are in there, like if they miss an appointment or if they have a tickler or things like that. But with this builder, we have these things that are kind of preset, and it's going to send out everyone that hasn't seen us in over 3 years. It's going to send out something tomorrow. It's set up for those that haven't seen us in the last 3 years, just to have them to call to make an appointment if there have any foot issues. So it goes out in a phone call, a text message, and an email. So that's another thing I figured out how to do today. But anyway, this is all within Athena. If you guys use Athena and you want me to make a video for Athena, I guess I can show you how to do that. That might be a cool thing on a video format. If you do, let me know. Okay. Once again, helping you guys get to the $1 million practice. If this is helpful, you'll have a lot more benefit going to Podiatry Practice Mastery and just getting my Practice Mastery Academy. Cheap money, help you get to the $1 million mark. And so it's basically nothing to get you there. Okay, thanks.